Hello, I'm Scott Pritchard, Director of Washington Wellness, the Health and Productivity Program for the State of Washington. It's my pleasure to tell you the story of how the project that you're hearing about came about. I think the context will make the story much more interesting as you get into the details, and it will also help you to appreciate the differences between doing this type of work in the public sector setting versus the private sector setting. The state is the largest employer in the state, as is often true. We're larger than Boeing, larger than Microsoft, larger than Starbucks. We have 140,000 plus employees, and if you add independents and retirees, that number is up over 250,000 people. The state is starting to recognize itself as an employer. And we have the same problems as employers everywhere. We have an aging workforce, healthcare costs are squeezing the budget, and we're slowly starting to recognize that health drives organizational performance, both positive and negative. This project is part of our governor's healthcare plan. Promoting prevention and healthy lifestyle choices is the first part of the plan. Also included is use of evidence-based care, better management of chronic illness, better use of IT, transparency, and access to affordable care. There is a shared responsibility for this program between the Healthcare Authority, the agency that does all the purchasing of health care and design of benefits, and the Department of Health that's in charge of public health. Washington Wellness is staffed through the Healthcare Authority, and fortunately we're not in HR where so many of these programs languish. We also have the advantage of having the Department of Health as a partner. Many private sector companies don't have the advantage of this expertise. We've had many influences, and I want to emphasize four of them. One of them is the Institute for Health and Productivity Management. This is a national, international group, a leader in the field of health and productivity, and they've been our partner through this project as well as a consultant. Secondly, the Puget Sound Health Alliance, a collaboration of businesses, providers, health plans, and consumers that are working to improve healthcare throughout the Seattle region. It's really important to notice that as an employer, even as big as we are, we can't change the healthcare system by ourselves, and this group is having a very positive influence. Third, the Center for Strategic Innovation. You've met Kathy and Roger as our consultants. They're experienced in this type of work and have been invaluable in helping us through the process. And finally, the National Governors Association, under the leadership of Mike Huckabee, helped the governors throughout the nation to recognize the importance of health in the state as an employer. In 2006, the Washington State Legislature again took on health care reform, and quality had an equal emphasis with cost control. Washington Wellness was placed into statute, and the demonstration project, the Healthy Worksite Initiative, came from the Senate Health and Long-Term Care Committee to us. The legislation we received was excellent. We were lucky. We knew the person that was writing the legislation, and she turned to us continually for input, so the legislation came out to fit very well what we were trying to do. We received $600,000 for the biennium. It had an automatic renewal. However, with our $4 billion deficit in state government this year, that automatic renewal is in question. We have 2 years for the project with a final report due in December 2010, and we named the project the Healthy Worksite Initiative. This legislation was an opportunity to take Washington Wellness 2 to 3 years into the future that we had mapped out. We identified 3 key elements. The first was the business model that we wanted to use, and that model put the agency at the center, not the individual. Population health, not individual health. The second element was data management. We would necessarily be using personal health information, PHI, and we needed some way to handle that. And third, agency selection. In state government, very often legislation tells agencies that they will participate. We wanted the early adopters, so we had to come up with a plan to get those agencies that really wanted to participate. The first element, the agency as the business unit. In health promotion, we've had 25 years of focusing on individual change, and it's been a failure. The health of Americans is significantly worse than it was 25 years ago. What we know is that environment and policy are the foundation. We want to take environment and policy and work toward what we're calling a culture of health within the employer. We're using the IHI Breakthrough Series as our process model and CSI as consultants. The second element is data management. We turn to IHPM as a partner. IHPM had begun doing field studies several years ago to test health and productivity management theories, and it appears that HWI is the very first group to focus on a culture of health as the centerpiece and use the IHI Breakthrough Series as a process. IHPM does data management and analysis. They provide a website, secure messaging, on-site biometrics, and they act as a consultant for the project. And finally, the third element, selecting the agencies. This was crucial. We didn't want agencies to participate that didn't have the senior leadership commitment to this process because it's hard work, it's new work. So we used a participation incentive model through an RFP to choose the agencies. The agencies that wanted to participate, that made it through the RFP process, were the early adopters. That turned out to be an excellent strategy. All 7 of the agencies we selected are doing excellent work. And finally, sustainability. We didn't want this to be a 2-year, really nice project with good results. We wanted sustainability. We wanted something that we could spread throughout the other 90 agencies within state government. To do that, the IHI Breakthrough Series uses a process that captures the essential change components, and we are calling that a change package that we're creating. This change package can then be used as a blueprint to take this process, give it to additional agencies, and spread this change throughout the employers in state government. The culture of health, we think, is the center as one of the essential drivers of organizational performance. Now back to CSI for the process and outcome details.